Hello and hearty welcome to everyone to this webinar hosted by Holy Child Auxilium School, New Delhi, in association with Social Communication Department of the province of Kolkata. All of us are living in this unprecedented times in which one needs to keep abreast about wellness and healthy habits. We extend our hearty welcome to Dr. Atul Kaka, Vice Chairman of the Department of Internal Medicines, and Dr. Sonia Rawat, Director of the Department of Preventive Health and Wellness of Sir Gangaram Hospital, New Delhi, who willingly spared their time to help and enrich our knowledge on healthy living. We are grateful to you, Dr. Atul and Dr. Sonia, for your generous availability. We pray that the Almighty God may preserve you safe and in good health as you serve the humanity tirelessly in these trying times. We salute you all for your selfless and courageous service. Thanks to all the attendees for taking time out and being here today. May the Almighty God keep us all safe and healthy. May I request Mrs. Ajanda Baumik, Senior Coordinator of the school, to introduce the resource persons of this webinar. Over to Mrs. Ajanda Baumik.
Thank you, sister. Good afternoon, all. Thank you for being here with us this afternoon. Today, we are pleased to welcome our two eminent resource persons, Dr. Atul Kakkar and Dr. Sonia Rawat, as our sister principal announced. Dr. Atul Kakkar is presently working as Senior Consultant and Vice Chairman in Department of Internal Medicine, Sir Gangaram Hospital and Associated Hospitals, New Delhi. He is a professor of medicine at Sir Gangaram Institute of Postgraduate Medical Education and Research. For public education, he released My Bone app on occasion of National Bone and Joint Day 2015. This is a phone app which can be downloaded from Google Play Store and educate people about risk factor and treatment options for bone diseases. And today, he will be sharing with us his expert opinion on understanding and boosting immunity. With this, I ask, ladies and gentlemen, that you give your full attention to Dr. Kakkar and help me in welcoming him on our webinar platform. Over to you, Dr. Kakkar.
It will be a little general. I'll be talking about what is corona infection. I think all of us know, but I just going through the knowledge again. And second would be how we can boost the immunity, especially during this period when we are not going to the school, we are not working, because that's the time when the immunity can be increased. And the third part will be general precautions which we can take and we should be taking now so that we can keep the infection at bay. So let me just start with the first that the corona infection is something which is not new to mankind, and we've seen lots of epidemics of this. However, the one which is going now is called a COVID infection. The name was given by WHO uh, because of certain things, which CO is for corona, and VI is for the virus, D is for the disease, and 19 stands for 2019 when it was first discovered way back in almost December of 2019 in Wuhan. So they didn't want to stigmatize the people living there, and that was the reason when this WHO took a stand that it should be called as COVID infection rather than giving a name to Wuhan infection. In past also we have seen very similar type of epidemic. However, that was not so severe as it is now. It is almost a pandemic which is now, and so many countries are involved, and there is a loss of human life and also economically the countries are not doing too well. The countries which have opened also, they're facing this kind of a problem. So the best, thing right now is to have adequate knowledge about the virus so that you can prevent it, you can boost your immunity. So that is the topic for the day. So let me just start with this thing, which is called, it's basically the structure of virus. It looks very fancy, but there is not much to it, except for, the outside has got spike-like projections, which you can see in green color, which from which the name comes crown-like corona, crown-like the outer surface has got this kind of a thing. And this is a very important thing because this also is a source from where we can manufacture the virus. So if we understand the virus, we'll be able to have, something which is against it. So this was basically about that structure. So I think all of us now know there is so much of information given because, that this infection spreads through a droplet infection. However, direct contact with the persons and fomites. Fomites are very important because obviously you can't see the virus, but the virus can stay over the surfaces. That is why, hand hygiene has been, emphasized for this control of this kind of a virus. As when you come to the signs and symptoms, because since now it is spreading into community, I thought let me just cover a little bit of the signs and symptoms also. Any person who is now coming with problems of fever, cough, whether it is dry or productive, usually it is more dry, or have shortness of breath, or there is blood in the sputum, which is just even the blood tinged, or he is confused, he's not able to answer to the questions you're asking, or has got multiple problems. In those kind of conditions, we are thinking that patient would have corona infection. And for the diagnosis depends upon taking a swab from the nose and also from the back of the throat, which is called a nasopharyngeal swab, and something which is called an RT-PCR can give us the results whether the virus is there in the body or not. Usually this sample is positive only in about, say about 70 to 80% of the persons. It also depends upon how the sample has been collected. So there are other ways also to isolate the virus and come to a diagnosis. This can be done through taking various other samples, including the blood sample. So I'm not going into details of that. But one thing is for sure that everyone should know, that even if there is any person who has fever, should be home quarantined for at least 14 days, irrespective of the cause of fever right now. Because, even if the testing is not possible in your center, you should think it that, the fever may be because of that if the symptoms are matching once you have discussed with your, the doctor. And all the surfaces should be cleaned thoroughly. I think Dr. Rawat is going to cover because she is a very good person who can talk about prevention. So she's going to tell you in detail about, how to take care of that. But anyone at home, they need to be having clean surfaces, including the bed surface, and the toilet should be clean, and the clothes should be washed separately. So as far as that was just the introduction about the corona the infection. But now is the time when we need to boost our immunity, because very soon the schools are going to start, and if we have a good immunity, despite all the contacts which we have, the infection can be avoided. So when we talk about a disease, there is something called natural forces within our body, and they are the true healers of the disease. This is a very old saying, but when we talk about this, what we basically mean is that our immunity is the thing which is responsible for keeping the infection controlled. And immunity, in simple words, it is a condition in which we are able to resist a particular disease. So, what it does, it protects us from the illness and also from unwelcome or harmful organisms. So, it's very important to understand this concept of immunity because in the last few weeks, you must have heard that one needs to work on the immunity and how to improve it. There have been so many WhatsApp messages going on that you take this or that, yeah, that will improve. But what is the truth that is should be known to majority of us? So this is a fact that microbes are all around us and they are also inside our body. But we have the resistance that the microbes cannot attack us. So that is because of our immune system. So majority of us, we know about the various systems in our body. We know that there is a cardiovascular system, our digestive system, but less is known about the immune system. The immune system is present throughout the body, and as you can see, it is from the throat to the legs. It's all over the body. The most important immune system in our body is related to that around the intestines, and it is called mucosa associated lymphoid tissue. It's going a little into the medical, but yeah, it's very important when we talk about immunity. And it is usually said that whatever we eat, the road to health is paved with good intestines. If you are eating well, your intestines are okay, your immunity will be quite okay. So this is a very important thing which I want to tell you about this. So all of us now we are born with certain immunity, which is called the natural immunity, and this is present at birth. This includes the skin which we have. It protects us from so many things, the organisms to enter the body. The eyes, they normally blink. We have tears so that anything which is falling in the eyes can be just washed off. Cough is thought to be a protective response, and inside our respiratory system we have small hairs which flush out the infection. Even if there's some infection which comes out, it can flush out the infection. And similarly, our urinary tract, the urine tries to flush out the infection in case we have. However, if any of these systems they go wrong, we can have infections. Now, a little bit about the types of immunity. Majority of the immunity which is there in our body is at birth, or it is passed through the mother's milk, which is called a passive immunity. A passive immunity also may be passed when a person is infected and we take his blood, we purify it, and we take out only the antibodies of that person. And if we take it, then we can also have passive immunity. They are basically ready-made immunity. So this was the whole mechanism of the plasma therapy, which was they were talking about in the infections, and there are few centers now which have been approved for this kind of therapy. So that was a passive immunity from either the mother's milk, or if we take the blood from a person who has recovered from that infection, and it can be passed on to a person who's diseased and can have a ready-made antibodies. So that is a passive immunity. In active immunity, we need to earn the immunity. So we can earn the immunity either through the infection, we can have the infection, or through an artificial route, which is called vaccination. So I'm going to cover vaccination a little bit after the slides. So the other important aspect now, which is coming in a very big way, is called a herd immunity. And you must have heard about this also so much from the press, which they're talking about herd immunity. This, what it basically means that there is a reduction in the likelihood of someone to catch the disease because a significant proportion of people in the community are immune to it. So if you look at this, the photo which has been given here, the person in the red is infected, and since the infection, he can always lead to the infection to susceptible people, and he's infected two people. And gradually, what happens that more and more people are getting infected, and this is what we want, that there should be some type of a herd immunity so that the infection transmission gets slow or decreases. So this is a very interesting slide which has been taken from various cities, and there are two types of dots in this, and the grey dots are the normal people, and the other dot, which is a purple colored dot, are the people who have already had infection of COVID infection, COVID-19 infection. And the first portion of the slide, if you see, that we should have at least 60% of the population uh, who should be infected so that our herd immunity is high. So that is what we want. We want to achieve that. But if you see across various cities in the world, the uh, the the antibody levels is not very high. So what we have, this is a slide which has been taken from various cities, from which is little about 2 to 3 weeks old, but tells you that the antibodies levels are ranging between 10 to almost 20%. And if you talk about the Indian statistics, our antibody levels are somewhere between 10 to 15%. The last week's statistics, which has been given by the ICMR. And we want at least 60% of our population should be infected so that we develop some type of a, so that the infection does not further spread. So, when we talk about immunity, there are many diseases which are related to it. A simple viral infection can also cause, because of the lack of immunity. Recurrent allergies can be because of this. Aging process is related to immunity, and also cancer. And there's certain group of diseases which are called autoimmune diseases, again, which is related to the immunity. So I'm not going to cover all of them, but I'm just going to tell you that in our immunity is in our hands, and we can train the immunity. So we can train the immunity by doing moderate exercises. We can take good diet, reduce the stress. We can have proper sleep, and we can also train our immunity by vaccines. So coming first to the exercise, it's a very important thing that majority of us should be exercising to the recommended, time. I'm going to tell you about that. But if you spend less amount of time or more amount of time, it does not benefit the immunity. So that what is required is that we should be exercising to at least that level so that it is beneficial for our immunity. And if you see the curve on the top side of the slide, it is a J type of a curve. So that if you are, having just a exercise of 5 minutes, 10 minutes, and people think, okay, they've done a good exercise, that does not help absolutely the immunity. And in case you are stressing the body with prolonged exercise, so it will again worsen the immunity. So what is required is that you want to have an optimal type of exercise, and I'll come to the duration. Now, the benefits of exercise.
Excuse me, sir. Excuse me, sir. Your slide is not visible. If you could share it on the screen share.
Okay. Okay.
Thank you so much.
Can you see it now?
It's not visible, sir. If you could show it. Otherwise, you can continue speaking. It's fine.
Okay. No, let me just see what has happened to the slides. Can you see now? Is it
Yes,
possible?
yes. Now
Yes,
it's
yes,
visible.
doctor. Yes, it is
Thank you.
visible.
Thank you.
Okay. So when we talk about exercise and the immunity, so it works at multiple levels. Exercise increases our muscular strength. It improves the conditioning of the heart. It also benefits our bones. And many diseases like blood pressure, heart diseases, stroke, diabetes, cancer, and depression. The exercise works throughout these kind of diseases, and also it helps to control our weight. So that's a very important thing. And yeah, so the recommended time of exercise now it's that's what I was trying to tell you that between the age of 5 to 17 years, our children should be working out for at least 1 hour per day, and in case they do an extra exercise or they have, it's going to benefit them. So that J type of curve does not employ to them, and they should also be doing something which is called muscle strengthening exercises at least 3 times a week. When we come to the age of 18 to 65, we should be exercising at least 22 minutes per week. This is the WHO's data, or 150 minutes per week, 22 minutes per day, or 150 minutes per week. And the data which is now available from across the globe, it has said that almost 80% of the adolescent population are highly inactive. So things which can be simply done at home are aerobic exercises like jogging, skipping, running, cycling, and power yoga. These are the things which can be easily done from home. The other important factor which acts, the stress is an important factor which acts on the immunity, and whether it's an acute stress due to something which is very small, which is happening, or something which is chronic. Chronic means that it is acting over weeks or months. It all acts through our system, which is called endocrinal system, and it causes more stress on our immunity, and it can give way, and we are more prone to infections in case the stress is more there. The how to improve the immunity then? So the immunity can be improved by taking vaccines, and I think majority of us are aware that the children should be taking vaccine, and this chart must be with all the parents. And but I would like to say that it's a very important card, and they should preserve it because it's like a passport to your health. You know when the vaccine has been taken, and many now schools and the university outside India are requiring the exact date when the vaccines have been taken. So that's a very important thing that we should try to preserve this kind of a paper. Two vaccines which are against cancer, I'll just name them. One is in human papilloma virus and the other is hepatitis B. And all of us and our children should be protected with taking this kind of a vaccine. Sleep is another thing which tries to improve the immunity, and there's been a very interesting study which has been done. If we take twins, and one of the child sleeps during the day and the other sleeps during the night, and it has been found that the children who sleep during the night at the same time, they have much better immunity as compared to children who are sleeping during the day. So it's important for us, to tell our children that they should have something called a sleep hygiene. They can maintain the hygiene by sleeping at the same time, and the late night playing, chatting, and all this kind of thing needs to be, shifted to the daytime. The major boost for our immune system is through this the diet which we have, and this is called a rainbow diet. Our plates should be colorful. It should have color red, green, orange, yellow. They should have nuts. And in case you're non-vegetarian, lean meat can be taken. Fish, the tuna fish, which has got very high omega-3 fatty acids. And also, you can take low-fat yogurt. The other things which also increase the immunity are the green tea, honey, ginger, garlic, and the red capsicum, the turnip. So all of them, I think majority of things we know about it. But when we are organizing our meal, we should see that, at least in each meal we have something which are going to increase our immunity. And it's not a question of eating on one day, it's over a period of time that the immunity will improve. There are certain things we should try to avoid and which will cause more inflammation in the body, whether it's something fried or colas or any processed meat which is there. Also, when we talk about dairy, it's not very good for our system. Although, as parents, we try to give more stress that the children should be having dairy and dairy products, but we should try to have a balance of between 2 to 3 helpings of dairy, not more than that, because one should also remember that India comes in a zone that almost 74% of the Indians are lactose intolerant. So as the age increases, we don't have the power to digest the milk, and that is the reason why majority of the Indians, they keep complaining of gas or bloatingness after taking milk and milk products. So finally, let me just go through a little bit about what we can do for prevention. We should not try to touch the face, wash our hands properly, and throw the face mask properly in a disposable. I think Dr. Rawat is going to talk about a little bit about it. And presently, we would not advise sharing of the food, utensils, and cups, towels, so that the infection does not spread. And the very important thing is how to clean the hand. And if I can just show you that, okay, there's another very important thing. So, there are two ways to stop the pandemic. One is when we don't do anything. So, what you can see, the red part of the graph, where you see the number of people have increased suddenly and then gradually they come down. And the other is through intervention. And what intervention we are talking about? We are talking about social distancing, hand washing, and what it can do, it can flatten the curve. So what intervention we want is through flattening of the curve through these kind of things, which I think Dr. Rawat is going to speak. But let me just tell you a little bit about it. Yeah, so there is something called hand hygiene, respiratory etiquettes, which are very important, and the hand should be, washed throughout. In case you can see the dirt, it should be for almost 1 minute. In case you can't see, at least 30 to 40 seconds, definitely. And this is the mnemonic to learn how to wash hands. This is called Suman. Sida, Ulta, Ungli, Muthi, Angutha, and nails. So finally, these are the steps which we can tell our students also how to wash the hands, and this a simple mnemonic like Suman. So I think respiratory etiquettes and all, Dr. Rawat is going to take in this. So, and the mask should be worn, and which mask. So I can take all this during the discussion, but finally, what I like to tell you is that you should not panic. The virus is going to be there with us. We need to learn to live with the virus now, and how we can live with it. Firstly, social distancing by frequent washing of the hands, and anyone who has got respiratory infection should be separated out, should not be allowed to enter the workplace. Okay, and this is finally our COVID ward, and in the middle you can see it's me, who just finished the round in the COVID. So thank you so much.
Thank you, Dr. Kakkar. Our next resource person, Dr. Sonia Rawat, is a medical graduate from MGM Medical College, Indore. She did her training at RML Hospital, New Delhi in general medicine and cardiology and later went to England under the Overseas Doctors Training Schemes. She was trained in England between 1996 till 1999 in general medicine, diabetes care, elderly medicine, gastroenterology, respiratory medicine. She later joined Sir Gangaram Hospital in July 2016 till date as a director of Department of Preventive Health and Wellness. And today she'll be sharing with us her opinion on challenges for reopening of schools and diet. So let's welcome Dr. Sonia on our webinar platform. Over to you, Dr. Sonia.
Thank you very much. Good afternoon, sister, again. And many thanks for calling us and for discussion about this very important topic. Dr. Kakkar has spoken very well, but I'm just going to re-emphasize on a few points here again that the slides that he has shown. This is the warm greetings from Sir Gangaram Hospital, where I am working as a director, Department of Preventive Health and Wellness. Dr. Kakkar has mentioned about this immune booster diet, and as he said, the rainbow diet. We are re-emphasizing this. It's very important, as you can see, all the oranges, the reds, the greens, and obviously the proteins coming from your red kidney beans there. You can see the seeds, nuts, you can see the chicken, you can see the fish, and very important, as you can see, ginger, garlic, honey. This is very important for boosting your immunity. As he said earlier, that if your immunity is strong, then even if the disease affects you, it'll affect you in a very mild form. You should avoid these foods which can cause inflammation, especially the French fries, the aerated drinks, the gluten and dairy. He's mentioned very well about dairy, that 74% of Indians, they have lactose intolerance. But again, for the people who are less than 18 years of age, they have to grow. So milk is very important for them, and yogurt, cheese, milk, they should be taken for these 18-year-old age groups. And as Dr. Kakkar mentioned, that as we grow older, our problems for digesting the milk is there. Hence, we should avoid dairy products. Challenges for reopening the school. It's a very important subject, and I'm sure you all will be facing this. And the Ministry of Health and Family Welfare have said opening of the schools from August 15th. Then also there are going to be a few challenges. And as Dr. Kakkar mentioned, the virus will be there and we have to live with the virus. So how do we do that?
Excuse me, ma'am, your slides are not visible. If you could share it with us.
The slides are not visible. Would you like to make them visible for me, because I've tried from here.
Okay. I'll tell the producer. Thank you so much.
Right.
Ma'am, could you please continue? They'll arrange it. Okay.
Okay. So as we are talking about the risk assessment and appropriate measures, we are talking about minimizing the exposure to COVID-19 in the work environment, resuming work after a period of closure, as you know, this is the holidays season going on, and coping with a high rate of absences, because there'll be a lot of people who will be absent from work, either they are sick or they are afraid. So that is also very important. And how to minimize exposure to COVID-19 at work? We have to allow the essential workers only to enter the building, reduce physical contact between the workers, example during meetings or during breaks, And whenever possible, arrange for them to work alone or in spare office, either staff room or meeting room. So again, as Dr. Kaka mentioned, again reiterating the fact that social distancing is very important and minimizing the amount of staff that you have. The vulnerable workers who are there, they should work from home, like the older people, like people who have high blood pressure or diabetes, or who have cancer, who are on cancer treatment, because definitely their immunity will be low. The pregnant women, their immunity will be low, and there's always a risk of transmission, vertical transmission to the fetus. Although it is around 10%, but still these people, they should be allowed to work from home. The office area, you should provide physical barrier between the workers. For barriers, you can use plastic sheeting or partitions, mobile drawers, or storage units can be used. So again, social distancing is very important. And if close contacts are unavoidable, then you have to keep the meeting of two people less than 15 minutes. The distance between two persons should be at least 6 feet. Even during the break time, arrange the timing of the meal breaks to reduce the number of people sharing a cafeteria or the staff room or kitchen, and also stagger the tea and lunch breaks. So you can give them alternate time for tea and lunch breaks. So staggering is very important. How to go about cleaning the common areas? You have to clean your premises regularly and frequently, especially high-touch surfaces like counters, door handles, tools, phones, switches, taps, sinks, and other surfaces that people touch often, and wear disposable gloves to clean and disinfect. Soap and water is the best because it is easily available, but other things like bleach and 1% hypochlorite solution can be used. And it is always important that we are wiping the surfaces rather than spraying. And we have to report all illnesses to the medical room. And toilets, especially toilets, we have to ensure that there is only one student at a time in bathrooms. You have to place a sign on the main door indicating when one of the toilets is in use to ensure that only one person is in a line enters at a time. Organize shifts to take account of cleaning and sanitation tasks, and soap and running water should be used on a regular basis. What to do when you are in the classrooms? So classrooms, as it's very important that the children wear masks. If they cannot get the masks from home, then there should be provision of the masks from the school. They should have a good ventilation if possible, and there should be supply of soap and water or some hand sanitizer at convenient places. Say the teacher can keep it, and the teacher can advise the students to wash their hands frequently. And you should always leave 2 desks in between when the children are being seated. And again, stagger class timings. So you'll have to sit down and work on it once the school starts reopening after the 15th of August. Again, disposal of waste is very important, as Dr. Kakkar was mentioning, that all the infectious waste, they should be going in the yellow bags so that people who are carrying them, they know that they are infectious and they have to use certain measures when they are handling the yellow bags. Use mask, triple layered masks, N95 masks, head caps or shoe covers, they can be put into the yellow bags. And in the red bags, you can put goggles, gloves or face shields. So again, disposal of waste is very important. We are using this in the hospitals, but again, it should be used in other places as well, including your school. Now, stay home posters, the children should be reminded again and again that if they are feeling unwell, they should report it to their parents. The parents should report it to the teachers, and place posters that encourages staying home when they are sick, cough, or sneezing. Etiquette should be taught to the child, that they have to use their elbows or they have to carry handkerchiefs. So this is very important that they are not coughing or sneezing on other children. And hand hygiene at the entrance of the workplace and in other areas is very important. So washing hands and staying home if you're sick are the key points. Again, when you're coming to the school, so how they're coming to the school, not everybody have their cars, so they'll possibly be coming by school buses, so using the collective transport. It's important how they are actually using their bus. You have to be very particular about using, again, the same particular precautions as mentioned earlier: hand washing, adequate seating, and again, once they come out of the buses should be sanitized adequately. Air conditioning, some schools are air conditioned. Ideally, we should avoid central air conditioning. Even in our hospital, we are avoiding central air conditioning. You should keep your doors and windows slightly open to allow for outdoor air intake. It's very important that you keep your ventilation very well set up. And the toilets and the kitchen's exhaust should be working adequately. The temperature between 24 and 30 degrees, and there should be relative humidity between 40 and 70%. Again, it's very important that temperature should be measured at the entry point for everybody. Disposable face mask should be worn. Again, you should use your hand sanitizers. You have to keep your waste bins properly stacked, and proper maintenance of hygiene should be maintained at all times. So this is very important. We have a few challenges coming up here, whether the vaccine, when will the vaccine be available for this COVID-19 situation? Hopefully we will be with India and with the help of US, we will be making a vaccine soon, and very soon there will be vaccine coming out, and hopefully we will all be using this vaccine. And as Dr. Kakkar said, this virus is going to stay. So like swine flu and like the other diseases which are there, this virus will also be there. So it's actually changing the way we are at the moment. So like earlier, when we used to enter our houses, we used to sort of put our shoes outside, wear something else, say slippers inside, wash our hands, wash our face, and have a well-balanced diet. So, and maintaining that cleanliness, maintaining that hygiene will be what is going to be our lifestyle now. So there will be a big lifestyle modification. Again, I'm going to cover some anxiety issues now, because we are all afraid. So what is anxiety? Anxiety just means constant worry about something. So anxiety disorder is affecting 16.6% of the population. And generalized anxiety disorders all over the world are 8.5% of the population, where panic attacks is also prevalent in 7.9% in most countries. We are all afraid of this virus. Sometimes we are claustrophobic, that we have to be locked in the house. And sometimes people have very little small houses, so they become claustrophobic. They become it's very difficult for them, and sometimes they get nightmares, sometimes they get really bad panic attacks. So don't worry. You have to, as Dr. Kakkar mentioned, that stress and immunity, you've seen that there's definitely a correlation between stress and immunity. So you have to keep your stress levels low. You have to not worry. And what is anxiety? As I said earlier, it's a feeling of persistent worry, and that makes an individual not able to relax properly. So you have to actually stray away from that. Generalized anxiety disorder is a syndrome where you have ongoing anxiety and you worry about many events, and certain feelings are there that patient recognizes as extreme and inappropriate. Individuals will manifest with physical and psychological symptoms leading to significant distress and impairment. There's also what we say OCD, is obsessive compulsive disorder. It's a form of anxiety where you have unwanted thoughts generate anxiety and perform repetitive actions. Like you must have heard certain people telling you that I wash a lot, I wash my hands a lot, or I clean a lot. So this is also a problem. This is obsessive compulsive disorder. So you have to stay away from all these things. Panic attacks, it defines as certain discrete periods of sudden symptom onset, usually peaking in 10 minutes. So sometimes you can face these panic attacks. And sometimes people can face post-traumatic stress disorder, where they have traumatic experience and they definitely avoid stimuli which is associated with the trauma, and they feel an extreme amount of fear and anxiety if they have to face that trauma again. So again, you have to get over this post-traumatic stress disorder. Evidence also indicates, and as Dr. Kakkar mentioned about the stress and immunity, that chronic repeated stress, if you have, that precipitates neuropsychiatric disorders like anxiety and depression, and you have to actually stay away. Your health is in your hands, and as I said, I am a director of preventive health and wellness, so prevention is always better than cure. So you have to make sure that you are taking adequate, well balanced, well nourished diet. You change your lifestyle, as we have already talked about, and you take the physical exercise, as Dr. Kakkar mentioned, and it has to be a good physical exercise. If you're doing 30 minutes of physical activity, you have to do it properly. And properly, I mean that you have to make those sweat glands work so that you're sweating at the end of 30-minute exercise. And of course, don't forget to relax. Don't forget to stretch your muscles following the exercise. So that is also very important. And this exercise can also release certain happy hormones in your body, which will get rid of the stress. And even then, if you're feeling stressed, then go and talk to a friend, go and talk to your family. Family is a big support. Have good support system. So that is also very important. Talking to somebody, because one of the treatments of anxiety is what we say cognitive behavior therapy. And cognitive behavior therapy is nothing but talking, counseling. So this is very important. And you still have these problems, so then you have to go and see your doctor, where they can actually help you with certain medications which will help you with anxiety. I'm sure you must have enjoyed our session, and with this I'm going to end my session. Thank you very much. Hello? Hello?
Thank you so much, Dr. Sonia and Dr. Kakkar. We are now going on to our question answer session. So there are a lot of questions which have come up. So the first question is actually for Dr. Kakkar. Dr. Kakkar, one of the audience has questioned that I'm a healthcare worker and I have a 3-year-old daughter. What precautions should I take while coming back from work? I think this would be same for also a lot of parents who have started going out to work. So over to you, Dr. Kakkar.
So anyone who is working in a setting which is a source of infection should be, in fact, the moment we are entering the hospital, we are changing our clothes, we are wearing a gown, we are wearing a shoe cover, we are wearing, cap and gloves. So that is a normal thing which all of us are doing. But the moment you're coming back, you're supposed to remove the shoes, as Dr. Sonia did say. There should be a separate area where you, as soon as you enter, the shoes should be totally removed. In fact, if possible, they should not enter the house. The clothes should be immediately removed, and they should be soaked in an ordinary, antiseptic. And then you enter the house, take a shower, and then you touch the other things which are required. So that is what is now recommended, and that should be the things, especially for the healthcare worker. And in case you're working in normal offices and all, I don't think you require so much of hygiene, but yeah, definitely hand hygiene and taking out the shoes, at least that can be done.
Thank you so much, Doctor. The second question, in fact,
Can I just add to it? I was hearing what Dr. Randeep Gularia was saying yesterday, that now, from now on, as the community transmission is increasing day by day, the COVID patients will not be managed in the hospital. They will be managed at home. And it is us who are going to manage our own people, like our father or mother or whoever suffers from COVID. So as Dr. Kakkar mentioned, I mean, it's going to be the lifestyle. It's going to be our changes in whatever we are doing day to day will actually help us.
thank you so much, Doctor.
And he
In fact,
has
the
very
next
well
part
mentioned
is-
about the herd immunity. If you were hearing before, so slowly, that is actually going to be very beneficial in the long run. And this virus is actually going to stay, at least in India.
Thank you so
Till
much,
September,
Doctor.
October. Yes.
The second part of the same question is basically for you. And in fact, as you know, a lot of our audience are actually the parents. So all of them, especially parents who've got very small children at home, toddlers at home. So they're really worried what they should do to increase the immunity of their little children. Any specific things, Doctor?
Dr. Kakkar has already mentioned, we mentioned about the foods that cause inflammation, and the toddlers and little children nowadays. I mean, I've got a son who's 9 years of age myself, and if you keep roti dal sabzi in front of him, and if you keep pizza in front of him, he would definitely want the pizza and the burger. And if you keep milk, he would not want the milk, but he would definitely want the spirited drinks. So again, it's very important that we have actually been brought up eating roti, dal, sabzi, a proper well nourished diet. I remember my mother used to make me drink 1 glass of milk before going to the school every day, and coming back from school, we used to drink the milk, and without anything, no, without any Horlicks or without any. It was just plain bland milk. But nowadays, children, they have so many of, I don't want this, I don't want that. If you give me this, I'm going to eat that. So these sort of things, the mothers and the parents, they should understand that what a well-balanced diet should be, and they should make the children understand that this should be what you should be eating. Okay, fine. If you want a pizza or a burger, we'll give it to you maybe once a week or once in 15 days. But not on a regular basis.
Because it's more of negotiation.
And again, as Dr. Kakkar mentioned earlier, immunity and exercise. So a lot of children are now becoming couch potatoes. Even the toddlers are becoming couch potatoes. They'll sit and watch maybe Dora the Explorer in front of the TV or whatever. So these outside games earlier, when we as children, we never used to stay inside the house after 6 o'clock in the evening. We were always out playing with our friends. So that culture should be again, minus the TV, minus the video gaming, minus the even small children nowadays. I can see a 4-year-old or a 5-year-old. Even those people can play games better than us, So I think that is very important, to exercise adequately, eat adequately, and take your sort of multivitamins on a regular basis. They can be given certain multivitamins what the doctors can prescribe to them. Vitamin C tablets, vitamin B complex, iron can be given to them if they are anemic. So this, on sort of talking to their pediatrician, they can actually get their children having a healthy, well-balanced diet and well-balanced lifestyle.
Thank you, Doctor. In fact, you've answered the next question, which I was going to ask you. That was whether it is safe to give supplements to children and whether we can take supplements if you don't have, even if you don't have any deficiencies. So I suppose that answers it. The next question, of course, is for Dr. Kakkar, and this is a question that a lot of people have asked, and they have, I mean, there are quite a few people who've asked this, and they're saying that we've heard that it is very dangerous to wear the mask. Especially for the respiratory system. So what are the do's and don'ts about wearing a mask, and what kind of mask should a person wear?
Yeah, firstly, wearing a mask is absolutely not dangerous, but you should know how to wear it. You know, when you're wearing a mask, you should first, there are two ways, you should tie the lower portion first, and removing also the lower portion should be first open, and then the upper portion should be tied. So first is that the mask should be at least having 3 layers for the common person. That's the second thing. And you should never touch the front portion of the mask, which is in front of the nose and the mouth, because that's the highly infected portion. So in case you're removing it, again, you have to remove the lower portion first and then the upper portion, which you're going to tie. And you should discard it in a proper way. For a normal person, or ordinary mask is what required, but you can make mask indigenously also. You can make it with cloth or any good cotton from, which can be at least 3 layered or so. The other is that people who are working in hospitals or healthcare workers, they need to wear a special mask which is called N95, but that is not for the common public. So I'm not going to tell you more about it. And it's not dangerous absolutely for persons who have respiratory symptoms, because in fact it's going to protect them rather than do any harm to them.
Thank you so much, Doctor. The next question also I would like to ask you. There's one particular person who has written about the fact that his child suffers from bronchitis issues very often. So what is the kind of advice you would give to parents whose children are very prone to these respiratory, maladies like asthma or bronchitis or something like that?
So anyone who is more prone to respiratory infections, they are also prone to this kind of a viral infection. It's a known fact, it's because it's again a viral infection which is there. So what they can do is, again, social distancing can be done, hand hygiene has to be maintained, wearing a mask, all these general precautions have to be taken. And also, if possible, they should be already being vaccinated for influenza, which is another very important reason where it can trigger the bronchitis. So I'm very sure the child would have been vaccinated for influenza vaccine. And in absence of any other thing, they should try to maintain little distance from any environment which is very dusty, which is having a lot of fumes, and these kind of things which should be avoided. Aerosols, perfumes, agarbattis, these kind of things which we normally do at home should be avoided for people who have bronchitis, because that can be a stimulus for them.
Thank you so much, Doctor. The next question is for Dr. Sonia. The question is, quite a few people have asked, is that how do we differentiate between viral fever, common cold, dengue, malaria, or whether it is COVID-19? Because the moment somebody coughs, automatically you tend to think it is, COVID, and people go quite panic-stricken. So they want to know how you can differentiate between these.
It's a very important question that comes to mind, because nowadays, the moment you have a viral illness, even flu-like infection, people just get freaky because they think that they are having this COVID-19. But COVID-19, there are certain, it's again a viral illness. Corona is also a virus, And the others that you've just mentioned, the influenza, common cold, this is also due to viral illness. So it's very difficult to distinguish as far as the symptoms are concerned. But as Dr. Kakkar mentioned earlier, that if you have, say for example, a high-grade fever, or if you have some blood which is coming out in your sputum, or if you have some shortness of breath, there are clinically these are the things that are worrying, and that should be kept in mind. So it is actually sort of seeing the patient, how the patient is reacting, and how the patient is actually sort of, if you give the medicines, how the patient is actually accommodating themselves. So it's general. What you're looking at is general. So you keep the patients well hydrated. You see for the urinary output how often they are going to the urine, etc. And if the fever is actually prolonging, say for example more than 3 days, then we would recommend that you should be actually thinking of, during these times, corona infection, and thinking about doing a nasopharyngeal swab for them.
So can I add?
Thank you.
Yeah.
Yes.
So
Yes.
actually, all of them which you mentioned are viral infection except for malaria. So there is, in fact, we've not seen a case of malaria very recently because it is seen post rains, and also dengue comes post rain. So what you need to differentiate is whether it's a simple viral infection or is it the COVID. In this scenario, more than likely that it is COVID than the ordinary, because it is spreading like fire now. But only soft finds are there, which I'm going to tell you. One is, running nose is not very common in COVID, although it is reported, but it's not a very common thing. In the normal cold and viral fever, which we talk about, there are more joint pains, arthralgia. In this, there is not much of that, although it can be. So these are very soft things which can tell us. And obviously, shortness of breath is a very important feature of COVID, which comes very early. And a majority of people have a cough which is dry, which is there, and they associated with that, they have shortness of breath. So that's a very soft features, but more than likely, any person who's having fever, if it's going beyond, as Mama said, that 3 days, you should try to investigate what is the reason. But majority of the tests, we do it at 4th day. In fact, 5th day is the chances that the positivity of the test is maximum.
Thank you so much, sir. There is another question which some of the audience have asked. This is for Dr. Kakkar. It says, given its low cost and short testing time, is antibody-based rapid testing method reliable to identify COVID-19? And should ICMR approve this test at individual levels?
So there is a lot of problem with the antibody test, and we've seen it ourselves also. Antibody test should not be a reliable test for making a diagnosis. There are two things. One is to make a diagnosis, and the other is for seeing how much of the community it is spread. So there are two things. For making a diagnosis, it's not 100% reliable test because the kits. It's something new. The kits have to be, standardized. So the kits have not been totally standardized. In fact, at one time, ICMR had totally removed the kits from at least the government hospitals, although we were still continuing. But we've seen that the reliability is not too great. So I would not recommend that, we should depend on it. But there are certain situations that if the fever is beyond maybe 7 days, 8 days, and the other nasopharyngeal swab, which is not available, and this test is also very cheap. And it's the report is also available in about 15-20 minutes. It's like a ordinary small test which we do. So in those situations, only the test should be done.
Thank you so much, sir. The next question is for Dr. Sonia. It's a question by Varnika, and it says there are many theories about the using of AC. which you yourself have mentioned. Is there any medical evidence for the increase or spread of virus through AC, or is it from the comfort condition? I can't get the rest of the question, but basically, so here it will also be using air conditioners at home, using air conditioners in offices, and using air conditioners also in cars when you're traveling.
There's definitely evidence, and as I mentioned in my slides also, that you have to keep the temperature between 24, so approximately 24 for the ACs, not lower than that, because there is a strong chance that the virus may be sucked inside your house through the air conditioning. And we are not definitely allowing the central air conditioners, say for example central air conditioners in the school, because say for example if one child has a COVID infection in class 1A, and there's central air conditioning all throughout till class 5, so that may be sucked in through the central air conditioning, and the class 5 child, those people may get affected, and slowly more children may get affected. So we are definitely not promoting the central air conditioners. For your home, if you're using it, you can use it, but at a higher temperature.
Thank you so much, ma'am. The next question is for Dr. Kakkar, but any one of you can take it. And this is a question by UK Shah. And the question is, how do we sanitize the different types of items we bring to the home as, for daily use? There are a lot of forwards which show that you put steam on them, you put it in boiling water, you put, baking soda on it and stuff like that. So is there a method which you can use? I think Dr. Sonia wants to answer this. So we can hear you. Yes, Dr. Sonia.
I'm doing this on a daily basis. Say, for example, if we are getting, say, vegetables at home. So what I normally tend to do is I normally sort of empty one of my sinks and fill it with water. And I put common salt in it, common salt and baking soda. So I actually dip the vegetables for approximately an hour in there. And when I'm taking them out, so I've already washed my hands with Dettol and proper soap and water. So some amount of soap also goes inside the vegetables also. So then when I'm actually washing them again, so in my other sink, I have plain sort of water. So the vegetables which are salty and with soda bicarb and some amount of Dettol soap, they go into the other sink, and there I wash it with sort of plain water, and then I actually keep them up for drying, and say I leave them for about, say, overnight, and the following day I'll actually place them in proper sanitized, clean polythene bags in the fridge. That's how I'll do them. And I'll probably do the same with milk products also. Say for example, if I'm getting milk bags, I'll get them inside my sink. I'll wash them with soap and water properly. Soap and water. So this time the vegetables with salty water and soda bicarb, the milk packets with soap and water properly. Whatever else I'm getting inside the house, proper soap and water. And I leave them in the soap water sink for quite some time, say half an hour, and then I'll wash them again, rewash them with proper water, and then I'll actually put them in my fridge.
Thank you so much, ma'am. But another continuation for this is that nowadays we're getting a lot of online purchases. So when things are dropped at our house, what do we do with that? How do we sanitize that?
Even the letters that are actually coming to my house. So I'll sanitize them with the ordinary sanitizer, which has probably got, say, 70 to 80% of alcohol in it. So that kills most of the virus. I'm sure Dr. Kakkar will agree.
Okay, thank you, ma'am. This is for Dr. Kakkar. The next question. It's posted by Deepthi Prasad. She's a parent, and what she has written is that we are living in flats. We do not have separate washrooms and no individual rooms for every person. In the case that we have to isolate at home, is it possible to do so, or what should we do?
Yeah, isolated. If you need to self quarantine or isolate yourself, you should firstly have a room to yourself. So that's the first requirement. And second is that it should be well lit. There should be a window. So if these two things are not there, the government has got the Arogya Setu app where you can ask also for certain hotels which are now attached to the hospitals where the care is not too much as required in the hotels, but yeah, majority of them would be just mild cases which we are talking about. So these are the two basic requirements. Also, in case you're sharing the bathroom, you should clean it with bleach, which is a diluted bleach, which Dr. Rawat has already mentioned. So that with each use, so that at least the infection, because the infection can also be transmitted through stools. So that is the other uncommon route, which I didn't mention because it's not a very common way of the infection can spread. So self quarantine should be done for at least 17 days. Earlier they were saying 14 days. Now they're saying 17 days. And certain people do it for even 21 days. But 17 days is a good enough period where the you are less likely to infect the other people.
Thank you so much, sir. Now, the next question is for Dr. Sonia, and this is a question which pertains to a lot of parents. They're very curious or they want to know about it. Is that now for the past few months, they've been sort of cocooned in their small flats with their children. And it becomes very difficult for them to get the personal space. So, and it has sort of been quite obvious that in many cases that the children are going into depression. Depression is now something which is very common. So what should parents do to help their children in simple ways by which they can, not get into depression and keep them happy, because they're not meeting their friends, they're not going to school, the whole time they have to be at home. So what can they do, Dr. Sonia?
The most important thing that the parents can do for their children is give them time. So that should be, because I can see that the parents are busy with their own phones, with their own social media apps, and the children actually are again becoming couch potatoes, watching TV or playing games, video games. This is the time. The lockdown was the best period where you could have actually given the child that time, which obviously you would have actually not given to them earlier when you were probably working. So play with them. Simple things like Ludo, Sapsidi, Monopoly. You can actually have that little bit of parent-child communication improvement. And again, by that, as I said to you earlier, anxiety and depression, the best form of treatment is talking therapy. So talking to each other, talking therapy, having a well-balanced diet. And as Dr. Kakkar mentioned, certain apps are there nowadays for exercising at home. My daughter uses a Fitness Marshall. So she uses Fitness Marshall every day and she exercises at home. And it's like a dance session which one person from the US has actually done on various English songs. So again, you're enjoying the songs, you're listening to that music therapy, which is again a therapy. So music is also a therapy. So you're using that, you're doing dancing. So those sort of little things can actually help you. And again, there's a big role of nourishment here. So certain things, depression. Why do we get depressed? Because there's various theories that there's chemical imbalances in the brain. Certain chemicals like serotonin levels, etc., they can actually go low, deficient. So there's certain, what do the medications do? They actually build up these chemicals in your brain. So there are certain things in your food which can actually give you these chemicals back. So give them those foods, well-nourished diet, and most importantly, as I said earlier, time to your kids.
Thank you so much, ma'am. The next question is for Dr. Kakkar, and this is a question posted by Ankit. It says, Sir, if a person gets infected by COVID-19 and has recovered, is there any probability to reoccur this infection again in that same person?
So hopefully not, because we are taking the blood of infected people, of people who had very severe infection, to give it for recovery. That's why I was talking about the passive immunity. So and also this is the therapy which is used now as a plasma therapy. So the chances are way less, because we know about the virus now. We know about the genetics of the virus. So there are antibodies which are formed, so which are going to protect us.
Okay, thank you, sir, so much. There's just there are lots of questions, sir, but I don't think there's enough time. But I'll just take one last question, and this for Dr. Kakkar, and that is, if you could repeat your the suman which you said of washing hands, if you could repeat it again for everybody.
Okay, so it is a simple step of cleaning the hands: Sida, Ulta, okay, Muthi, and then Angutha, and the nails. So these are the steps which you can easily do it. I can also share the slide so that I can show. You can get the slides back. Yeah. So these mnemonic is easy to share also, and you should do it for at least 40 seconds. And in case there is visible dirt seen, because if you are working in the gardens or some cleaning, and also should do it for a minute.
Okay, thank you, sir. And this is for both the doctors. Some of the parents, in fact, quite a few have asked if it is possible, if you could share the PPTs and the PDFs with the school authorities so that the children can, benefit from it, if it is all right.
So
They've
Yeah,
asked.
sure.
Okay.
it's already been recorded, so you can share the link. Yeah, there should be no.
Okay, thank you so much. This is there are a lot of questions still coming in, but I'm afraid this is where
Can I
we.
just add
Yes,
to what Dr.
ma'am.
Thakkar just mentioned? For little children, the teachers can teach them the happy birthday song. So happy birthday to you, so they can just sing out to themselves whilst they're washing their hands. And my son, what he does is he makes crocodiles, he makes butterflies on his hands whilst he's washing. So it's again simple, like in washing it between your fingers, wiping your thumb. So that's how, they can just make it like playful when they're washing their hands.
That's very interesting. I think the little children will really enjoy it. So even though there are many more questions coming up, I think this is where we have to end the seminar, the webinar. So Honorable Provincial Sister Rose, respected Sister Superior, Sister Celine, Principal, our most valuable invited guests, ladies and gentlemen, it is my privilege that I have been asked to propose a vote of thanks for this occasion. So on the behalf of the HC Auxilian School fraternity who have gathered here today, and on my own behalf, I would really like to thank all of you for sharing your knowledge with us today. A big thank you for Dr. Atul Kakkar for all his efforts towards clearing our doubts and helping us to understand and how to boost our immunity, especially his advice about Suman and how to clean our hands. We found it extremely interesting. I must also mention over here our deep sense of appreciation for Dr. Sonia Rawat for her inputs on the challenges of reopening schools, which all of us are facing, and also about our own diet. And I'm sure all of us will always remember to keep in mind your statement that this virus is here to stay and that we have to boost our immunity to safeguard ourselves. We are all inspired by your words, doctors. I'm extremely grateful for the love and guidance of the FMA management that has gone a long way into making this event a reality. Our gratitude to the Home Science Department with Mrs. Namita Astana at its helm and the Social Communication Department of the province of Kolkata for showing great foresight in arranging this event for all of us. I would like to take this opportunity to place on record our thanks to Ms. Monica Manchanda, Ms. Masuma Sultana, and Ms. Ajanta Bomik for the perfect logistic support and guidance they've extended to all of us to make this webinar a success. These are, unprecedented times, and I would like to really, give my appreciation also for the FMA management who has, extended all this for us, and also for the parents and guardians for being part of this movement and have a healthy approach in combating this pandemic. We are sharing on screen right now the contact details of both Dr. Atul Kakkar and Dr. Sonia Rawat in case you would like to reach out to them. Thank you so much for being part of this event. It has really been a great pleasure. Thank you so much. Thank you.
So thank you, Dr. Sonia and Dr.